Well, welcome everyone. Thanks for coming to our second group of presentations for the fall 2018 term. My name is James and we're coming to you from the McMaster Health Forum at McMaster University. So welcome. An agenda for today's presentations. I will give you a quick rundown of the McMaster Health Forum, our current Queen Elizabeth Scholarship Program, our new scholarship program, and then I'll turn it over to our presenters. We have three groups of presenters. The first two are outgoing scholars. The first group of three went to Malaysia. The second scholar went to England. And then we have a special guest, our first incoming scholar from our new scholarship program, who's visiting us from Colombia. And we will end things off with a question and answer session. So the McMaster Health Forum is a leading hub for improving health outcomes through collective problem solving. We aim to harness information, convene stakeholders, and prepare action-oriented leaders, and act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is run by a partnership between the Rita Hall Foundation, Community Foundations of Canada, Universities Canada, and individual Canadian universities. The purpose of the program is to activate dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The version of the Queen Elizabeth Scholarship program that's offered here at the McMaster Health Forum is called Strengthening Health Systems. Our scholars will contribute to strengthening health systems and become part of our large and growing network of health system leaders. We have been honored to receive a second Queen Elizabeth Scholarship Program, which is just starting. Applications are in full swing for 2019. We are one of 20 Canadian institutions to host this next round of scholars in the scholarship program, and will run from 2018 through to the end of 2021. This new program is called the Queen Elizabeth Scholarship Program in Strengthening Health and Social Systems. So we see there's a slight change in our focus. This new program is very similar to the one that is just ending. There are some differences that I'll just note very quickly. The location of the internships is expanded. So the old program was all Commonwealth countries. We are now able to expand that to include low and middle income countries as well. Our partners, because of that, have changed. So we now have partnerships in Colombia and Lebanon with other potential ones on the horizon. And the focus of those internships has changed slightly to include social systems along with health systems. And because of this, our eligible programs have changed. So all of the same graduate programs are still eligible, but we have added the arts and science program at the undergraduate level. And the number of opportunities has changed. So by the end of the program that's currently ending, we will have hosted or sent abroad 61 scholars. In this new program, we will only be hosting or sending abroad 24 scholars. So you see there's quite a difference in the number of scholarships that we are able to offer. Speaking of that old program, we divided them into three different cohorts. This first cohort primarily went away or visited us in 2016. We had a good mix of incoming scholars, and outgoing interns. Our second group was the largest group. This cohort primarily went away or visited us in 2017. You see that was a large group of scholars that went abroad during the summer of 2017. And our presenters today, at least the first four of them, are part of this cohort. This is the cohort that primarily went away in the summer that's just passed in 2018. We also hosted a large incoming scholar contingent during the summer of 2018. And we currently have 5 scholars who are abroad as we do this presentation. So who are our first scholars? So here there are the first 3 will be presenting together because they all traveled together to the same location. Our first is Alex Dragoman. Alex is currently still, I believe, an undergraduate student in the Bachelor of Health Sciences program here at McMaster. His interests include exploring how healthcare can be better delivered to senior patients in response to an aging population, and how health policy can shape perspectives and responses to substance abuse and addiction. Alex hoped to learn more about how informed policymaking can impact healthcare quality and improve health outcomes, and how countries can develop the infrastructure to support health systems research. So we're looking forward to see how successful he was in attaining those goals on his internship. Next, we have Bolade, who is also still, I believe, an undergraduate student in the Bachelor of Health Sciences program, specializing in global health. She has a strong interest in effecting systematic changes to improve health services and reduce health inequalities, especially among vulnerable populations. During her internship, she hopes to gain a deeper understanding of the knowledge translation process that sees research and context drive policy and the influence of political actors in politics in shaping the performance of the health system. And last but certainly not least is Tereza. Tereza, also an undergraduate student in the Bachelor of Health Sciences program here at McMaster. She's interested in initiatives relating to and or combining health policy and health economics that seek to reduce regional and global health inequalities. During her internship, Tereza hoped to learn more about the relationship between research evidence, policy, and practices, as well as their dependence on cultural context. So, 3 presenters, all with something interesting to say, I know for sure, and I will now turn it over to the 3 of you.
So for our QES experience, we had the chance to travel to Malaysia for 3 months and work with the Institute for Health Systems Research, or IHSR. So now, to begin, here is a visual that continues to stress our parents out each and every time without fail. And so it's worth mentioning that the distance from Canada to Malaysia, it's quite long. With layovers, the trip took over a day and a half, and the time zone difference is like 12 hours. So really, even the trip there was like unlike any other journey we've ever made prior to QES. And then just to zoom in on Malaysia, Malaysia is made up of Peninsular Malaysia and East Malaysia. So Peninsular Malaysia is to the left, it borders Thailand, and it's separated from East Malaysia by the South China Sea. East Malaysia is on the island of Borneo. So we were located in Peninsular Malaysia, and specifically we were in the state of Selangor, which is marked in blue there. We were in Shah Alam, and for reference, we were very close to the capital city, Kuala Lumpur. So with that, we can begin and share our time in Malaysia. So we'll start by talking about the hierarchical or organizational structure of the Ministry of Health and the Institute for Health Systems Research. Then we'll talk about some of the different departments we were attached to throughout our time there. And it's worth mentioning that as we were attached to different departments and not a single project or projects, we won't be able to go in depth or at length on any given project, but instead we'll try our best to provide a comprehensive overview of our time there. And we'll also be talking about some institute-wide activities that we participated in. Next, we'll talk about our experiences in Malaysia as well as QES Takeaways, both as they relate to IHSR as well as just our own learning and personal development as well, of course.
All right, so to go over the MOH and IHSR structure. So the Malaysian Ministry of Health is very much similar in its function to other health ministries across the globe. What may be unique to Malaysia is that it actually has what are called National Institutes of Health, and there are 6 of these, and each of them have their own activity mandate. And the goal of the NIH broadly is to provide contributions in health sector reform through facilitating decision-making at various levels, focusing on the policy level within and outside of the health ministry. So the 3 of us were situated at the Institute for Health Systems Research, as we said earlier, and that's the green box bolded in the middle, if you can see it. So IHSR is a WHO collaborating center, and it's specifically for the health systems research and quality improvement activities that they conduct. So IHSR essentially supports the NIH's goal through capacity building in priority areas. And one of those is knowledge translation, or KT, which we'll talk about a little later, in health policy and health practice research. And IHSR's activities can be grouped into 3 categories, so research, training, and consultancy. So they conduct research in priority areas identified by the MOH of the government. They provide training to professionals in and out of government health sectors, as well as internally to their own staff, and they do a lot of consultancy with partners. And the purpose of all of this is to improve the health system in terms of the structure as well as service delivery. And within IHSR, there are several departments. So 7 of those relate specifically to research. Like the others are departments like admin and stuff, so we didn't really include that. So 3 of those departments we stayed in, so it's quality assurance, health outcomes research, as well as health policy, and that's why those are bolded on the furthermost right-hand side.
Okay, and with that we can talk about the first department that we were attached to. So that was the Quality Assurance Secretariat, or QA. And so QA was formed as part of the Quality Assurance Program in Malaysia. So the Quality Assurance Program seeks to monitor the quality of services delivered in the healthcare system, detect shortfalls, and systemically investigate and enact corrective measures to fix these shortfalls. And so as you can see here by the visual, the QA Secretariat is somewhat of an intermediate between the national level and the program or district levels of the quality assurance program. And in fact, it is considered to be the coordinating body between the national indicators approach, which is top-down, as well as the hospital-specific and district-specific approaches. So just to provide a bit more information on what those are, the national indicators approach involves the outlining of national quality improvement goals to clinicians and or policymakers at the clinical, district, state, and national levels, whereas the hospital-specific and district-specific approaches have more to do with empowering local policymakers and clinicians to identify their own problems that they're facing in their institutions, come up with quality indicators as well as a plan to fix those solutions, and then continue to monitor their quality improvement process. And so that's just kind of like a big picture view of what QA does. So a more specific description of their activities would include 1, monitoring and evaluation, 2, research to improve the and to add to the body of knowledge on quality improvement in Malaysia, 3, consultancy in various capacities, and 4, training these local health leaders that are part of the hospital-specific and district-specific approach to quality improvement. And then as for our work with QA, much of which actually involved shadowing some of their activities that I just mentioned. In addition to that, we also worked on their ASEAN project, which was for the development of ASEAN recommendations for quality healthcare in primary care. So we were engaged in the more intermediate steps of this project. It was after a lot of the data was collected from all the ASEAN member states. And just for context, ASEAN is a regional intergovernmental organization, and it's considered probably one of the strongest unions in that area. So in terms of intergovernmental participation and engagement. So yes, we helped with the collection and assessment of the baseline data from the questionnaires so that we could understand the opportunities and challenges facing each of these healthcare systems. And based on that, we were able to form policy recommendations, which alongside of other policy recommendations will be reviewed in upcoming conferences and workshops with all the ASEAN member states to eventually lead to kind of a mandate of what the what ASEAN hopes to be kind of like a guide of what an acceptable level of quality and structure in their respective healthcare systems would be. And this is a very interesting project. We were able to learn a lot about the Malaysian healthcare system as well as a lot of the other neighboring healthcare systems. So it was nice because we were able to make some comparisons there, and I think we were able to learn a lot about the region in general. And then, so the next project we worked on was a rapid review. And it was a rapid review on strategies to reduce dental caries among school-aged children, asking the question, what institutional strategies can reduce the number of dental caries to improve oral health among school-aged children in Malaysia? And so QA has already been working on this issue for quite some time, noting that dental health is one of the 12 healthcare programs under the National Indicator approach, and it is right now considered to be a healthcare priority. So we decided that a really good way to present some of the information on effective strategies to reduce the number of dental caries in Malaysia would be to create a rapid review. And so QA did have some experience with the rapid review methodology, having done an evidence brief with the previous cohort of scholars, and also just based on their own knowledge. And it was decided that we would use this approach because it's also very suitable to their role in the healthcare system, noting the feasibility and timeliness of rapid reviews. So that was kind of like the bulk of our project there. And then also important was walking QA through the rapid review methodology, and we used a lot of the forum's techniques for that. So that was like a big part of it, a lot of knowledge transfer and exchange there. And then these are just 2 pictures. That was a candid that I captured of Bolade sharing a moment with our colleagues talking about dental caries. And then the second photo, I believe Alex is going over the AMSTAR checklist. So, thank you.
So the second department that we're a part of was the Health Outcomes Research Division, and they're mostly focused more broadly on national health outcome measures. And they do this through assessing interventions, whether they be clinical or population-based. They develop and carry out methods for health outcome assessment, and in general, they work to build skills and capacity in conducting research, as well as in monitoring and evaluating health outcomes. So at HORD, we're involved in two main projects. So one was relating to knowledge translation. If you remember, I alluded to earlier, KT is a huge part of IHSR. And what we did was for the PUN study, so PUN stands for Patients on Voice Needs, and there was a medical anthropologist in the HORD department, and what she had done was she had conducted a study that was assessing the gap between what patients want going into a clinical encounter and what they actually receive from their healthcare provider. And essentially through this study, they were able to come up with some recommendations as well as some potential interventions that can reduce this communication gap. And essentially what we did was, using their research process, we helped map what they did onto the knowledge to action cycle, which is part of the KT process. And another thing that we did was we developed and delivered a presentation on KT to dental students. So in particular, these were students in dentistry school, also pursuing a master's, to kind of help bridge that connection between what they're studying their master's to how it can be applied in their own clinical practice. And the second main activity that we did with HORD was relating to the healthcare demand questionnaire, which I'm going to talk about in a little bit. But just to refer that photo there, that's a photo of us with a couple of colleagues in HORD actually going over the healthcare demand questionnaire. So in terms of the healthcare demand questionnaire, the purpose of this was to, every 4 years, Malaysia, they put out a survey that citizens in the country fill out to assess the healthcare demand for the National Health and Morbidity Survey. So the next one is going to go out in 2019. So what we kind of did was we participated in some pre-testing as well as some validity assessments. So we were invited to a stakeholder dialogue, which is really, really interesting because it's really cool to see all the different professionals. So they're from different fields, and they also had their own priorities and competing agendas. So there were a lot of different voices at the table, but it also kind of highlighted to us the importance of hearing their input as to what they thought was relevant, or if they thought a particular indicator was being assessed fairly and appropriately. So for example, one of the more recent things that they were implementing into their questionnaire was to assess the role of caregivers in the health system and how they're properly supporting them. And this questionnaire was also interesting because this is the first time that it includes citizens in East Malaysia, like we talked about earlier. Usually it's only citizens in Peninsular Malaysia that are surveyed for this. So there needed to be certain extra steps in the verification to ensure that it was also applicable to the regions in East Malaysia because they're quite different, and we'll kind of talk about that a little later. And this was just honestly fun to be able to be a part of because it was a very dynamic conversation. It kind of felt like a very large group meeting. And pictured above is one of the pre-readings that we did for this. So on the photo on the right, that's us in Sungai Besar. So Sungai Besar is a rural community. And one of the kind of desires that Alex, Tereza, and I expressed when we first came was we wanted to experience rural care in Malaysia. So our amazing colleagues helped us do that. So in Sungai Besar, they were also, so in addition to hearing professionals' voices at the stakeholder dialogue, we also had the chance to, test the questionnaire on the actual patients that it's going to be used on. So we didn't actually do any testing. We were mostly just observing, but it was nice to be there. And the photo there is us in the morning undergoing a training on how the testing for the day was going to work. And there were other testing was also occurring in more urban areas as well, but they placed us with rural because that's kind of what we expressed our interest in witnessing. And this was really exciting for us because even though we played the role of observers, we're able to attend postnatal home visits as well as see the interactions between the researchers and the patients and kind of get a better picture of the on-the-ground reality of the work that we're doing in the office.
And so for the last leg of our journey, we spent it with the Health Policy Research Division, KADK. And broadly speaking, their aim is to look at the concrete policies and strategies that the government and the Ministry of Health have been putting out and evaluate the progress, evaluate shortcomings and successes therein. And so we spent about 3 weeks with the Health Policy Research Division. And the first project that we were involved with while we were there was looking at hypertension policy in Malaysia. And so as a little bit of background, Bolade mentioned the National Health and Morbidity Surveys that go out periodically in Malaysia that we worked on. And over time, these surveys have been indicating that hypertension is increasing across Malaysia in adults, which is pretty standard for a country that's income level is rising as rapidly as Malaysia's is. And interestingly enough, the rates have been increasing, but the rates slowed and almost stopped from in recent years. And so some hypotheses surrounding these increases in hypertension, which are very alarming to the health sector, are that low education might be leading to low health literacy and people aren't aware of the health risks associated with this hypertension, that low education is correlated with low income and therefore low access to healthcare, and that the economic growth of Malaysia is leading to more opportunities for sedentary jobs, sedentary lifestyles, increased access to unhealthy foods, greasy, convenient foods, more time for things like smoking and drinking, and more money for those activities. And so our task really was to come in and take a look at what policies the government had put in place so far within the last decade, so from 2008, to address rising rates of hypertension. And what our task was to look through the literature and look through government publications, mission statements, guidelines, and see what's been published in order to address hypertension from a clinical perspective and from a public health perspective and an educational perspective. And what we found was that a lot of programs targeted education and kind of increasing access to information among patients, so through things like phone apps, things like web pages, public health information sessions, and there was also some reference to clinical guidelines and different strategies to increase the access of medications, but those were far outweighed by the just amount of information provision that the government was trying to do. And so our time there was very limited, only 3 weeks, and so while we were able to look through the information that we had available to us and find what programs were available, we weren't able to go on to the next step, which I think will be really exciting, which is to evaluate how these programs are doing, where the shortcomings are and where the successes have been, and where to scale up and where to change things up. So that's the next task that the Health Policy Research Division has ahead of them for this project. Another thing that we worked on was we were very fortunate to be able to be in Malaysia during a period of, I guess, political turnover, where there was a new government coming into power. And so with that came a new health minister. And so the Minister of Health wanted a briefing on the Peduli Sihat program, which was implemented in Selangor, where we were based, but in no other state across Malaysia. And so there was some curiosity from the Ministry of Health in whether they want to expand the program and how progress had been going so far. So a little bit of background about the Peduli Sihat program is it's a healthcare coverage scheme that wants to provide the very lowest income families in Malaysia with increased access to medical attention before it becomes something that they absolutely need to seek. So more targeting things like preventative medicine and regular GP visits. And the way this works is through a card which can be given to individuals or to families, and they can seek medical care, and the card will cover the medical costs from that physician visit up to a certain cap. And so what the Health Policy Research Division was tasked with doing was to have to sort through a lot of data and to present this to the Minister of Health in a very condensed way and a very accessible way to give a brief overview of how the program had been doing and whether it was something to look at in terms of expanding. And so when we came in, we had a lot of data which we redacted because we're not sure if we're supposed to share it. So this is just a small sampling of tens of different spreadsheets that we had to sort through and figure out what was important to share, what did we want to convey, and what could we what could we accurately say? And so we were very fortunate to be able to sit in with the department and contribute to their discussion on which information was the most relevant to share and what things could we say with certainty and which things were conjecture. What can't we say for sure about the data? And we then worked on actually condensing this data into some figures. These are figures that we made and we've also redacted the information here, to show different trends that were highlighted within the data and present this in a one-page briefing we weren't physically presenting it to the Minister of Health, but this was part of a one-page briefing that would go to the Minister of Health. And we had a great opportunity to take this chance to look at how condensing information and better understanding it can let us come to some interesting questions and interesting conclusions. So some questions that came out of our work with this information were, why are visits per patient increasing over time? Are patients becoming more sick? Are patients becoming more comfortable using the Peduli Sehat program? Where is this burden of out-of-pocket expense concentrated? Is it spread out across the different patients, or is it concentrated on the very sickest ones, and how can we address it if that is the case? And is this benefit actually working to improve health outcomes? So we saw how by looking at the available information, we can come up with questions to ask for how we can further conduct research to find out more about the programs that the government's implementing.
So that's that on the departments that we were attached to. So in addition to kind of more department-specific tasks, we also were able to participate in some institute-wide activities. So again, there was a couple of knowledge translation presentations, as well as some workshops that we were invited to take part in with our colleagues. So pictured on the left is us with two of our great colleagues. So one is Dr. Sandi, who's was the acting director at the time, and the other is Dr. Shamsia, who was the head of the QA department. And on the right, it's a picture of us from a work function. So in terms of KT presentations, like I was not joking, we did a lot of stuff on KT. On the left-hand side is a photo of us during our KT presentation to external partners, so in and out of the Ministry of Health, as well as it was mostly, other stakeholders from the other institutions that were not just IHSR, so that's us pictured on the left. And on the right-hand side is our presentation on KT to internal stakeholders, so people that were not necessarily associated with the departments that we're attached to. And these differed from the KT presentation that we delivered during our time with the HORD, because this was a lot more comprehensive, and we kind of had more interactive activities throughout this one. And next, I also mentioned that we were invited to take part in some workshops. So one that we were a part of mostly during our time with HORD was the Questionnaire Development, Reliability, and Validity Testing workshop presented by Dr. Johanna Salim. And basically this was in preparation for the healthcare demand module that we talked about earlier. And pictured is one of her slides from the presentation. So she kind of mostly talked about making sure that it is asking questions that we are prepared to receive answers to, as well as keeping it flexible for change in case there is a need for that. And on the right-hand side we're not in that photo, but it's another workshop that we went to on risk management. And this is really interesting because it talked about risk management in the context not of a hospital or a clinical setting, but in a research or health system setting, which was a new perspective for us. Because I think we were mostly used to risk management in terms of those workplace modules that we typically watch. And like Alex mentioned earlier, I think we all thought that we came to Malaysia at literally the perfect time, because there's just so much happening that we were able to experience and just kind of fall in love with the place for that reason. So one of the things was in Malaysia, it's a Muslim majority country, so we happened to be there during the month of Ramadan, which is a fasting period, followed by a series of cultural festivities and events, and we were invited to a lot of those. So pictured on the bottom left is at another work function, or the same one, I'm not too sure. Again, just kind of celebrating the end of fasting. And then also, we happened to be in Malaysia during durian season, And that was the first time a lot of us got to taste durian, so we were able to learn how to cut it and like kind of some certain meals it's prepared with, which is cool. Another thing that Alex alluded to earlier was we came like 2 or 3 weeks in was like a national election, which is a big deal, especially because we're missing out on the election in Ontario, at least physically anyway, so it's cool to still be a part of an elections in a different place. And what made this really significant was because since Malaysia had gained its independence in 1957, there had been like one political party that continued to be in power, but this was the first time that there was a regime change, which is a big deal because you could really, like, you could feel the excitement like in the air and like the energy of the people. It was like really incredible to witness. And yeah, we were just able to be a part of that and talk to people about that, which is really cool. And another thing on like more personally, when I going into Malaysia, I expected it to be more homogenous, but I was completely mistaken. Malaysia really prides itself on like being very multiracial, multi-ethnic, and kind of having different ethnic groups and cultural like identities kind of identify as like under the banner of like one Malaysia, which is really cool. So for example, in Malaysia, the ethnic distribution generally goes to, there's Malays, Chinese, and then Indian, but then they all identify as like Malaysian, and that was like kind of really exciting for us to see.
And so we also managed to go on a few trips, and I won't go over them in too much detail just because that could be a whole presentation on its own, but all the journeys that we went on were like extremely memorable and just served to reaffirm what Bolade just mentioned about Malaysia being extremely diverse. And one example I can give is when we went to Georgetown, we visited Harmony Street, and there are many places of worship there, and specifically 4 religions are represented on that single street. So it was very interesting to see that, and there's a lot of religious tolerance as well as cultural tolerance, as Bolade just mentioned. And then I would also just like to highlight East Malaysia, because I feel like a lot of times when people talk about Malaysia, like East Malaysia is kind of underrepresented. The population is much smaller, but we actually had a chance to visit, and we went to Kuching, Sarawak. It was extremely eye-opening, and it was funny because it was right towards the end of our trip where we started to feel like we kind of like got a feel for Malaysia, and we were very used to our life, inshallah. So coming here, it was very interesting because specifically we noticed that there are a lot of minority groups in this part of Malaysia that we like really didn't have any encounters with in peninsular Malaysia, like the Iban people and the Bidaya people. So that was very interesting. And again, as Bolade mentioned, we realized, wow, Malaysia really is a cultural mosaic, just like Canada. Yeah.
So I don't really have too much to say about this part, aside from that I think it's fairly safe to say that about half of our time in Malaysia was spent eating, and there's an absolutely astonishing amount of food there, and it's all delicious. And every Malaysian person that I ran into would ask, the first question they would ask me when they found out I was foreign was, what's your favorite food? And so we every day had to physically ask people to stop bringing us food because they were bringing us so much stuff to try, and we were eating so much, and we really loved the food in Malaysia. So if you're there, it's an amazing culinary experience. But aside from the culinary experience and the traveling, we shouldn't forget that we were interns there, and we were there to learn, and we did learn so much. So in terms of skills, we learned, we gained experience writing a rapid review. We saw the development and the testing of a questionnaire, both in an office setting, and then saw it with our boots on the ground in a rural health clinic, which is amazing. We got to create and deliver a series of presentations on KT because this is what a lot of different departments at IHSR asked of us, and we were challenged with tailoring that to different audiences with different backgrounds on the topic, and also challenging ourselves to learn more about it through the process. In terms of policy, we got to see the role of one single institution within the Ministry of Health, but that one single institution was one of 6 and had so many different moving parts within it itself, and to see really the scope of how much goes into health policy and how much work there is and how many moving parts there are into everything that the Ministry of Health does. And also we got to experience stakeholder dialogues and see how people from across the country were coming together to discuss what was important to them and come to an agreement on what to include. We worked on information presentation and we learned how to sort through what stakeholders would find important and how can we present that information effectively. And on a personal and professional level, we got to work with a huge multidisciplinary team of pharmacists, doctors, nurses, healthcare researchers, statisticians. We had such a great team to get to know and to network with, and we got to immerse ourselves in a culture that we weren't familiar with, but that was so welcoming to us. And some of us went very far in learning the language. I'm talking about Tereza. She bought herself a dictionary. She was studying every day. It was a really fantastic experience from an educational perspective and also from the perspective of learning about a different culture. So we're very grateful for the opportunities that we've had these past few months.
And yeah, we just want to say thank you to the Rideau Hall Foundation, the Queen Elizabeth Scholarship Program, the BHSC office, James for teaching us and allowing us to be a part of this, to you guys for listening, and of course, IHSR and Malaysia, our colleagues there, that made it feel like we never even left home.
For sure.
Oh yeah, terima kasih, that's thank you in Malaysian. So yeah, that's our presentation.